Okay, Assalamu alaikum everyone, welcome back to the channel. In today's video we are doing something powerful. This is straight 50 MCQs from the past papers, no breaks, no parts, no interruptions. Back to back MCQs to boost your exam preparation. Make sure to stay focused till end because these questions are important and exam oriented. And if you want exclusive study material, handbook or masterclass, you can email me at the address given in description. So now without wasting any time, let's get started. Question number 1. At which knee flexion angle the moment arm is maximum? Option A 45 degree, option B 60 degree, option C 90 degree, option D 30 degree. And the right answer is option B 60 degree. So the next question is, a therapist monitors patient blood pressure using the brachial artery. What effect would you expect to see on the measured blood pressure value if the therapist selects blood pressure curve that is too narrow in relation to the circumference of their patient arm? Option A, systolic values will be higher and diastolic values will be lower. Option B, systolic values will be lower and diastolic values will be higher. Option C, systolic and diastolic values will be higher. And option D, systolic and diastolic values will be lower. And the right answer is option C, systolic and diastolic values will be higher. Next question is, following are the benefits of vocal music except? Option A controls pain and anxiety. Option B provides musical career. Option C improves eye-hand coordination. Option D improves speech. And the right answer is option C, improves eye-hand coordination. Question number 4. A therapist attempts to obtain information on the integrity of C7 dermatome. The most appropriate location to assess the dermatome is option A, little finger and ulnar border of the hand. Option B, lateral forearm of the thumb. Option C, palmar distal phalanx of the middle finger. Option D, medial forearm. And the right answer is option B, lateral forearm and the thumb. Next question is, the treatment of choice in an elderly lady with fractured shaft of humerus is option A, open reduction and internal fixation. Option B, external fixation. Option C, traction. Option D, POP immobilization. And the right answer is option D, POP immobilization. Next question is, the contraindication of hydrotherapy is option A, convulsions, option B, respiratory disease, option C, incontinence of bowel and bladder, and option D, all of the above. And the right answer is option D, all of the above. Next question is, question number 7 is, the communication adaptations include following except? Option A, adaptations to the computer and keyboard. Option B, build up pen and pencils with eraser grip. Option C, electric leather touch typewriters. Option D, voice activated motorized wheelchair. And the right answer is option D, voice activated motorized wheelchairs. Question number 8. A therapist examines a patient besides when the patient IV become disconnected. The therapist's most appropriate response would be to option A, reconnect the IV. Option B, contact the primary physician. Option C, contact nursing. Option D, continue with your present treatment. And the right answer is option C, contact nursing. Next question is, following a traumatic brain injury, a patient suffers from ataxia. How is ataxia defined? Option A, lack of movement. Option B, weakness of one side of the body. Option C, slow movement. Option D, uncoordinated movement. And the right answer is option D, uncoordinated movement. Next MCQs is number 10. The pain sensations are modified by the release of neurochemicals from the CNS, including option A, adrenaline, options B, endorphins and enkephalins, option C, thyroxine, option D, prostaglandins. And the right answer is option B, endorphins and enkephalins. Question number 11. Extended sternotomy is done for option A, CABG, coronary artery bypass graft, option B, bypass for descending aorta, option C, CMV, option D, CASG. And the right answer is option number 11. Oh, right answer is option B, bypass for descending aorta. Case number 12 is dashboard injury may give rise to option A, injury to ACL, option B, injury to MCL, option C, injury to PCL, option D, injury to meniscus. Injury ACL is anterior cruciate ligament injury, MCL is medial cruciate ligament injury, and PCL is posterior cruciate ligament injury. And the right answer is option C, injury to PCL. Question number 13. The name of coil used to produce Faraday current in past was option A, chalk oil, option B, smart Bristow Faraday coil, option C, induction coil, option D, none of the above. And the right answer is option B, smart Bristow Faraday coil. Option number MCQs number 14 is the ductility of tense collagen tissues increases when temperature increases up to option A 35 degree, option B 40 degree, option C 45 degree, option D 42 degree. And the right answer is option B 40 degree. Question number 15, MCQs number 15. A diagnosis of bicipital tendonitis has been made following an evaluation of patient with shoulder pain. The best shoulder position to expose the tendon of the long head of biceps for application of phonophoresis would be option A, in external lateral rotation with extension, option B, internal medial rotation and abduction, option C, horizontal adduction, option D, abduction. And the right answer is option A, external lateral rotation and extension. Next is question number 16. In case of AK amputee, prosthetic knee stabilization can be achieved by option A, action of gluteus maximus, option B, trochanteric knee alignment, option C, extension aid, option D, all of the above. And the right answer is option D, all of the above. Now the question number 17 is the rate of tissue elongation is faster than relaxation because option A, rate of fluid reabsorption is faster than rate of fluid release. Option B, rate of fluid release is faster than rate of fluid reabsorption. Option C, elongation is an active process whereas relaxation is passive. Option D, relaxation requires more energy than elongation. And the right answer is option B, rate of fluid release is faster than the rate of fluid reabsorption. So the next question is question number 18. Which muscle would be paralyzed if the sciatic nerve were severed? Option A, trapezius, option B, bicep femoris, option C, gluteus maximus, and option D is gluteus maximus also. So the right answer is option B, bicep femoris. So the question number 19 is a patient in need of physical therapy treatment interventions to assist with quad atrophy following ACL reconstruction. The patient is 10 days post-surgery and unable to elect a good quad contraction. What would be the best electrode configuration for muscle education of the vastus medialis oblique? So option number 1 is Option A, 4 electrodes surrounding the distal medial aspect of the quadriceps. Option B is 1 small electrode over an anterior thigh and 1 large electrode over the VMO motor point. Option C is 1 small electrode over the VMO motor point and 1 large electrode over the anterior thigh. And the option D is 2 electrodes over the anterior thigh. And the right answer is option C, 1 small electrode over the VMO motor point and the 1 large electrode over the anterior thigh. So next question is question number 20. What is the international color code of an active, neutral and earth white? Option A, red brown is active, black blue is neutral and yellow and green is earthed. Option B is black blue is active, red brown is neutral and yellow green is earthed. Option C is red brown is active, yellow green is neutral and red brown is earthed. And option D is yellow green is active, black blue is neutral and the red brown is earthed. And the right answer is option A. Red brown is active, black blue is neutral and the yellow green is earthed. Next is question number 21. Histology of myositis ossificans mimics. Myositis ossificans topic is really important. So option A is osteosarcoma, option B is osteochondroma, option C is GCT and option D is Ewing's tumor. And the right answer is option A, osteosarcoma. Next question is therapist explains to patient the benefits of using electrical stimulation for muscle reduction. The patient appears to understand the therapist's explanation, however seems extremely frightened and asks therapist not to use electrical device. The most appropriate therapist action is option A, reassure the patient that electrical stimulation will not be harmful. Option B, use only small amount of current and select another appropriate treatment. Option B is use only small amount of current. Option C is select another appropriate treatment technique. Option D is discharge the patient from physical therapy. And the right answer is option number C, select another appropriate treatment technique. Question number 23. The low frequency current is up to option A 1000 Hz, option B 50 Hz, option C 100 Hz, option D none of the above. And the right answer is option A 1000 Hz. Question number 24. In acute respiratory failure, how much tidal volume will decrease at the shunting? Option A 8 ml per kg body weight, option B 10 ml per kg body weight, option C 5 ml per kg body weight, option D 15 ml per kg body weight. And the right answer is option D 15 ml per kg body weight. Question number 25. You are studying diabetes mellitus and diabetes insipidus. In your clinical pathology course, which of the following statements is not true about diabetes mellitus but best describe the diabetes insipidus? Option A, it is a disorder of carbohydrate metabolism. Option B, it results from insulin deficiency. Option C, it's associated with pancreas. Option D, it's associated with pituitary gland. And the right answer is option D, it is associated with pituitary gland. Now question number 26 is order liver is the liver of speed. Option A first, option B second, option D C third, and option D all. And the right answer is option C. Right answer is option C third. So the question number 27 is, the part of the shoe absent in CTEV boot is option A lace chase, option B ball, option C heel, option D throat. And the right answer is option C heel. Question number MCQs number 28. A therapist begins prosthetic training activities for a patient with transtibial amputation. Which of the following is the most appropriate initial activity? Option A ascending and descending stairs, option B marching in place, option C walking on even ground, option D weight shifting and standing. And the right answer is option D weight shifting and standing. MCQs number 29. Concessions for the disabled are given in all categories except option A travel, option B food, option C postage, option D custom exemption for electronic larynx. And the right answer is option B food. Question number 30. Overstretching of the gracilis and adductor muscle on the inner thigh results from option A soccer, option B tennis, option C horseback riding, option D bowling. And the right answer is option C horseback riding. MCQs number 31. Which statement is true about Golgi tendon apparatus? Option A found in joint capsules. Option B detects overall tension in tendon. Option C originates in Purkinje fiber. Option D is activated by vagal reflex. And the right answer is option B detects overall tension in the tendon. MCQs number 32. How can the bronchial secretion of a 5-year-old boy with cystic fibrosis best be described? Option A absent, option B normal, option C abnormally thick, option D abnormally thin. And the right answer is option C abnormally thick. Question number 33. Rocker bottom foot results from option A congenital vertical talus, option B poliomyelitis, option C clubfoot overcorrection, option D both A and C. And the right answer is option D both A and C. Question number 34. Tightness of oblique retinacular ligament is characterized by option A decreased distal interphalangeal joint flexion with PIP flexion than with PIP extension. Option number B is decreased distal interphalangeal joint flexion with PIP extension than that PIP flexion. Option C is decreased IP joint flexion with MCP joint flexion than the MCP joint extension. And option D is decreased interphalangeal joint flexion with wrist flexion than that with the wrist extension. And the right answer is option B, decreased distal interphalangeal joint flexion with PIP extension than that with PIP flexion. PIP means proximal interphalangeal flexion. Then MCQs number 35. The precautions for disabled patient while going to bath is accept. Option A item needed for the bath should be kept out of his reach for his safety. Option B no-slip rubber mat for safety. Option C grab rails along the bath area. Option D bath oils and shampoos that make the floor slippery should be avoided. And the right answer is option A. Items needed for bath should be kept out of his reach for his safety. MCQs number 36. In Thomas test position limitation of hip adduction range is indicated shortening of option A DFL, option B ITB, option C iliopsoas, option D rectus femoris. And the right answer is D, option A, TFL. Question MCQs number 37. Which muscle does axillary innervates? Option A deltoid, option B brachial, option C pectoralis major, option D none of the above. And the right answer is option A deltoid. Question number 38. Dopamine is synthesized by option A globus pallidum, option B substantia nigra, option C subthalamic nucleus, option D putamen. And the right answer is option B substantia nigra. Okay, so the MCQ number 39. In the case of Guillain-Barré syndrome, partial to complete recovery take place usually within dash months. Option A up to 3, option B 3 to 6, option C 6 to 9, and option D 9 to 12. And the right answer is option B 3 to 6. MCQs number 40. Obturator innervates muscle in the lower body including the option A gracilis, option B adductors, option C obturator externus, option D all of the above. And the right answer is option D all of the above. MCQs number 41. A physical therapist evaluates a 2-month-old infant with multiple medical problems. When she touches the infant's cheek, the infant turns his head towards the therapist and opens his mouth. The physical therapist has tested what reflex? Option A Moro reflex, option B startle reflex, option C stepping reflex, option D rooting reflex. And the right option is option D rooting reflex. MCQs number 42. A newly hired physical therapist is concerned about the safety of the work site to which he has been assigned. Which of the following government agencies' primary function is to ensure safe workplace for employees? Option A JCHO, option B OSHA, option C APTA, option D CDC. And the right answer is option B, OSHA. In which accessory movement multiple joints along one articular surface contact multiple points on the another articular surface? Option A, slide, option B, rotation, option C, spin, option D, roll. And the right answer is option D, roll. MCQs number 44. The best expectorant point is option A ST44, option B ST36, option C SP10, and option D SP6. And the right answer is option A ST44. Question number 45. Which of the following is true concerning the scapula? Option A. The end of the spine projects as the expanded process called coracoid. The coracoid articulates with the clavicle. Option B. Option C. The glenoid fossa is where the scapula and humerus articulate. And the option D is the lateral border of the scapula is near the vertebral column. And the right answer is option C. The glenoid fossa is where the scapula and humerus articulate. So, the MCQs number 46. Jaipur foot may not be appropriate for BK amputees, below knee amputees. Option A, long stump. Option B, medium stump. Option C, short stump. Option D, knee disarticulation. And the right answer is option A, long stump. So, MCQs number 47. A physical therapist is researching what percentage of patients who have had a total knee arthroplasty at the local hospital receive follow-up outpatient physical therapy. He obtains a list of people who have had this surgery in the last year. He intends to call each person on the list to obtain his information. How should he word his question when speaking with each patient? Option A. Did you seek the service of a licensed physical therapist following your total knee arthroplasty for increased range of motion and strength? Option B. Didn't you need to go to physical therapist after your knee surgery? Option C. How many physical therapy treatment did you receive following your total knee arthroplasty? Option D. Did you attend outpatient physical therapy services after your recent knee surgery? And the right answer is option D. Did you attend your outpatient physical therapy services after your knee surgery? MCQs number 48. An excessive amount of nitrogenous waste product in blood is known as nitrogen. Option A, nitrogen. Option B, toxemia. Option C, azotemia. And the right answer is option C, azotemia. So the question number MCQs number 49. A therapist prepares a sterile field for wound debridement. Which of the following method would be unacceptable when removing objects from the sterile field? Option A, using sterile towel. Option B, using sterile gloves. Option C, using a bare hand after a thorough scrubbing. Option D, using a sterile gauze pad. And the right answer is option C, using a bare hand after a thorough scrubbing. And the last question number MCQs number 50 is cryptorchidism is a condition in which option A, thyroid gland is enlarged. Option B, parathyroid hormone function is increased. Option C, incomplete descent of testes in newborn. Option D, benign tumor of prostate gland. And the right answer is option C, incomplete descent of testes in newborn. So that's all 50 MCQs completed in this single video. No breaks, just pure exam practice. If you found this video helpful, make sure to like the video, subscribe to the channel and press the bell icon so you never miss the upcoming MCQ session. Comment down below how many MCQ questions you got correct out of 50. See you in the next one.